The module is designed to emphasize a key part of public health practice partnerships and the importance of forming and maintaining them. Planning for physical activity and public health is a key focal point of the chapter, and students should become very familiar with the U.S. National Physical Activity Plan. You may consider the following questions. What do you think of when you hear the word partnership? Are there different kinds of partnerships? How could, or would, forming collaborative public health partnerships help in the promotion of physical activity and exercise? What strategies would you develop or implement to develop effective collaborative partnerships to promote physical activity and exercise? And they are needed to promote physical activity and exercise. Relationships that focus on mutual cooperation and responsibility, and they are needed to promote physical activity and exercise. Partnership are necessary in the field of physical activity and health. Physical activity, and barriers to physical activity, occurs throughout the day during leisure time, occupational physical activity, transportation-related physical activity and school physical education. Their areas are all opportunities in which to engage in physical activity, yet they rarely join together to achieve a common goal. The private health club industry does not see a role for itself in school-based physical education to promote physical activity in children. State departments of transportation, with their emphasis on increasing capacity for motor vehicle travel, pay little attention to increasing opportunities for active transportation with bicycle lanes and sidewalks. Because of the broad societal implications of increased physical activity, partnerships are critical to emerging field of physical activity and health. Partnership development refers more to working with organizations than individuals via collaboration. All partnerships are not created equal. Generally, partnerships can be categorized as cooperation, coordination, or collaboration. What three types of partnerships are commonly seen in physical activity and public health? Define them. Partnerships are usually less formal and less structured than the other forms. For example, two organizations can agree to partner to promote physical activity in a community, yet each continues with its respective work. They may share resources and communicate on a regular basis, but not much else happens. Coordination partnerships are more formal and structured around the compatibility of the mission statements of all the partners. An example is two or more groups united to promote physical activity by sharing resources, for example, personnel, finances, other tangible support toward a common goal, for example, a community physical activity promotion campaign. Coordination partnerships are more in-depth and formalized than cooperation partnerships. Collaboration partnerships are the most organized and structured form of physical activity partnering, uniting groups, or individuals or both toward a common cause or mission, for example, the global promotion of physical activity and exercise. Collaboration partnerships are the most formalized type of partnership, involve some written understanding among the partners, and require a shared long-term goal. There are several steps to building partnerships in physical activity and public health. How are partnerships built? What should you look for in potential partners? How will you know the partnership is working? There are no easy answers to these questions, and they can be different for different types of partnerships. What are 5 key questions that increase the success of a public health partnership? Answers may vary but should include 5 of the 9 key questions contained in Table 16.1 in the text. 1. Do I need a partnership to accomplish my physical activity and public health objectives? 2. Who should I recruit? 3. Once the partnership is created, who should lead? 4. What are the goals of the partnership? 5. What is the level of involvement and cooperation of each partner? 6. How will the partnership operate? 7. On what should the partnership focus? 8. How do we get to our long-term goal? 9. Is the partnership working? Overall, the goal of physical activity advocacy focuses less on individual behavioral change, and more on achieving advances in political commitment, policy support, infrastructure, funding, and systems changes. Active Texas 2020. Active Texas 2020 is a contemporary physical activity partnership designed to increase levels of physical activity in a large population. The plan involves the state of Texas, which has a population of over 24 million people 2009, and the development of a state-level plan to make physical activity a health priority throughout Texas by 2020. Active Texas 2020 is a state-level plan that provides measurable goals and a framework. It is an adaptable set of tools that local leaders can use to design their own community plans based on their unique priorities, assets, needs, risks, opportunities, and challenges. The hope is that focusing on and enabling physical activity behavior changes at the local level will help all Texans become more physically activity and healthier. 8 Principles of Active Texas 2020. 1. Physical activity improves health. 2. Public health approaches to increasing physical activity are needed to improve population's health. 3. Make healthier choices easier choices. 4. All health is local. 5. Health is everyone's business. 6. Prioritize leadership, collaboration, and partnerships. 7. Work from the evidence base. 8. Evaluate effectiveness. What are 4 Active Texas 2020 leadership strategies that local leaders can use to increase physical activity in their communities? Answers may vary but include the following. 1. Establish a coordinated leadership effort that can ensure collaborative investment of resources in that community. 2. Having established a leadership strategy that provides effective coordination of resources and efforts, a community will be poised to assess local priorities, set goals and targets, and define the measures they will use to track progress. 3. Develop strategies and resources to reach community goals and targets. 4. Use evidence-based strategies. 5. Focus on getting the resources needed and sustaining the initiative. 6. Advocate strong return on the investment.